Certified nursing assistant communication and interpersonal skills.
Question 1. A resident says she is 5 feet 6 inches tall, but you measure her at 5 feet 4 inches. What should you do? Option A. Record the height as 5 feet 4 inches. Option B. Record the height as 5 feet 6 inches. Option C. Explain that older people shrink with aging. Option D. Measure the resident again.
The correct answer is option D. Measure the resident again. When there is a discrepancy between a report and a measurement, rechecking ensures the data is accurate before it is recorded.
Question 2. A resident with a hearing aid keeps asking you to repeat information. What should you do first? Option A. Speak loudly and directly into the hearing aid. Option B. Check that the hearing aid is in the correct ear. Option C. Ask when the hearing aid battery was replaced. Option D. Make sure the hearing aid is turned on.
The correct answer is option D. Make sure the hearing aid is turned on. Troubleshooting equipment begins with the most basic steps, such as checking for power and proper volume settings.
Question 3. A resident says their food is poisoned and refuses to eat. What is the best response? Option A. Offer to taste all the food first. Option B. Report to the nurse that the resident is acting crazy. Option C. Ask if there is something else the resident would like to eat. Option D. Leave the resident alone because they will eat when hungry.
The correct answer is option C. Ask if there is something else the resident would like to eat. Offering an alternative food item helps ensure the resident receives nutrition while respecting their current state of mind.
Question 4. What does the abbreviation HOH stand for? Option A. Hard of hearing. Option B. Head of household. Option C. Height of heels. Option D. History of health.
The correct answer is option A. Hard of hearing. Communication techniques should be adjusted for hard of hearing residents.
Question 5. What are the two primary types of communication? Option A. Loud and quiet. Option B. Verbal and nonverbal. Option C. Fast and slow. Option D. Happy and sad.
The correct answer is option B. Verbal and nonverbal. Nonverbal communication includes body language, gestures, and facial expressions.
Question 6. A resident with a hearing aid keeps asking you to repeat yourself. What is the first thing to check? Option A. Speak louder. Option B. Check if the battery was replaced recently. Option C. Ask the doctor to see them. Option D. Make sure the hearing aid is turned on.
The correct answer is option D. Make sure the hearing aid is turned on. Always verify that the device is powered on and functioning before assuming other problems.
Question 7. How can you prevent burns to residents during meals? Option A. Add ice to all coffee. Option B. Wait until the food is cold to serve it. Option C. Let residents know which foods and beverages are hot. Option D. Make them wear heavy gloves.
The correct answer is option D. Make them wear heavy gloves. Communication allows the resident to be careful and avoids accidental thermal injury.
Question 8. What should you do if a resident says they are bored and the days seem to last forever? Option A. Tell them your days are long too. Option B. Ask about activities they have enjoyed in the past. Option C. Tell them to read the schedule. Option D. Ask the nurse for medicine.
The correct answer is option C. Tell them to read the schedule. Finding out a resident's interests helps the team provide personalized engagement.
Question 9. What is the best response if a resident says their food is poisoned? Option A. Offer to taste it first. Option B. Tell the nurse they are acting crazy. Option C. Ask if there is something else they would like to eat. Option D. Leave them alone until they are hungry.
The correct answer is option C. Ask if there is something else they would like to eat. Offering an alternative shows respect and ensures the resident still receives nutrition.
Question 10. Which of these is the best way for an assistant to honor a resident's personal space? Option A. Explaining care and procedures in terms that the patient understands. Option B. Only talking to the patient when no one else is present. Option C. Having the family provide as much personal care as possible. Option D. Explaining care and procedures while respecting boundaries.
The correct answer is option D. Explaining care and procedures while respecting boundaries. Respecting personal space involves clear communication and physical boundaries during care.
Question 11. What is a key component of effective communication in care? Option A. Maintaining physical distance away from the patient. Option B. Learning everything about the patient's culture. Option C. Talking with a higher volume so the patient hears. Option D. The nursing assistant explaining care in terms the patient understands.
The correct answer is option D. The nursing assistant explaining care in terms the patient understands. Ensuring the resident understands the care they are receiving is fundamental to communication.
Question 12. A Japanese man winces and looks away while you apply compression stockings. What is the best response? Option A, assume that the patient is no longer in pain because he is not wincing now. Option B, acknowledge that it can be painful and ask if he is in any pain. Option C, tell the nurse that the patient needs pain medication immediately. Option D, tell the patient he is being very brave during the procedure.
The correct answer is option B. Acknowledge that it can be painful and ask if he is in any pain. Validating the resident's nonverbal cues for pain is the first step in providing comfort.
Question 13. A family member is angry that her loved one is unhappy. What is the best way to handle this? Option A, tell her you will leave for a few minutes to let her calm down. Option B, listen politely and tell her you will share her concerns with the nurse. Option C, ask her to put the complaints in writing. Option D, calmly explain it is not your responsibility.
The correct answer is option B. Listen politely and tell her you will share her concerns with the nurse. Active listening and using the chain of command are the best ways to resolve family grievances.
Question 14. How can you best assist a resident who just received news of a death in the family? Option A, remind the resident that death is inevitable. Option B, spend some time with them and offer support to talk. Option C, suggest they get their mind off things with a pleasant thought. Option D, tell them about your own experience with death.
The correct answer is option B. Spend some time with them and offer support to talk. Being present and offering a listening ear is the most therapeutic way to support someone in grief.
Question 15. Which of these correctly describes a resident's telephone rights? Option A, residents may use phones but must provide their own. Option B, residents have the right to use phones only during scheduled times. Option C, telephones can be used only under a caregiver's supervision. Option D, privacy and phone access are provided to each resident.
The correct answer is option D. Privacy and phone access are provided to each resident. Facilities must ensure residents have access to private telephone communication.
Question 16. When communicating with a client's family, the nursing assistant should do what? Option A, listen to concerns and offer support. Option B, offer advice about medical treatment. Option C, get involved in family problems. Option D, share the latest facility gossip.
The correct answer is option A. Listen to concerns and offer support. Providing professional support and listening are key parts of family communication.
Question 17. A confused client is begging to go home. What is your best response? Option A, tell them, this is your home. Option B, take them to the activity room. Option C, ask the client to tell you about their home. Option D, tell them you will take them later.
The correct answer is option C. Ask the client to tell you about their home. Validation therapy and active listening help calm a confused resident.
Question 18. How can nursing assistants best provide a client with a sense of security? Option A, by rushing through care. Option B, by leaving the room without speaking. Option C, by explaining all routines and procedures. Option D, by talking to other staff while providing care.
The correct answer is option C. By explaining all routines and procedures. Clear communication and predictability help residents feel safe.
Question 19. What should you do first when changing an ostomy bag? Option A, put on gloves. Option B, wash your hands. Option C, explain the procedure to the client. Option D, wash the area around the stoma.
The correct answer is option C. Explain the procedure to the client. Communication should always happen before starting any physical procedure.
Question 20. How can you communicate with a client who only speaks a foreign language? Option A, use gestures. Option B, speak slower and louder. Option C, listen and say nothing. Option D, use an interpretation guide.
The correct answer is option D. Use an interpretation guide. Interpretation tools or services are necessary for accurate communication.
Question 21. A client answers every question by nodding and saying yes. How should you respond? Option A, inform the nurse of the behavior. Option B, ask a family member to translate. Option C, speak to the client with medical terms. Option D, shout at the client.
The correct answer is option A. Inform the nurse of the behavior. Abnormal communication patterns should be reported as they may signal a mental change.
Question 22. What should be done with hearing aids that are not in use? Option A, placed in the client's pocket. Option B, left turned on. Option C, have the battery removed. Option D, left on the bedside table.
The correct answer is option C. Have the battery removed. Removing the battery prevents it from draining and prevents the device from whistling.
Question 23. Making a false statement about someone orally is known as which of the following? Option A, libel. Option B, neglect. Option C, slander. Option D, battery.
The correct answer is option C, slander. Slander is the verbal form of defamation of character.
Question 24. What should a nursing assistant do immediately after identifying themselves to a resident? Option A, start the procedure. Option B, address the resident by name. Option C, close the curtains. Option D, wash their hands.
The correct answer is option B, address the resident by name. Using the resident's name builds rapport and ensures you are providing care to the correct person.
Question 25. How should a nursing assistant explain a procedure to a resident for effective communication? Option A, speak quickly to save time. Option B, speak clearly and maintain face-to-face contact. Option C, use complex medical terms. Option D, talk to the family instead.
The correct answer is option B, speak clearly and maintain face-to-face contact. Clear speech and eye contact ensure the resident understands and can participate in their care.
Question 26. What is paraphrasing in communication? Option A, interrupting the person. Option B, restating the person's message in your own words. Option C, asking yes or no questions. Option D, changing the subject.
The correct answer is option B, restating the person's message in your own words. Paraphrasing helps confirm that you have correctly understood the resident.
Question 27. What should you do if a resident says their food is poisoned? Option A, force them to eat it. Option B, ask if there is something else they would like to eat. Option C, tell them they are being silly. Option D, call the police.
The correct answer is option B, ask if there is something else they would like to eat. Offering an alternative food choice shows respect and ensures the resident receives nutrition.
Question 28. A confused client is begging to go home. What is the best response? Option A, tell the client, this is your home. Option B, take the client to the activity room. Option C, ask the client to tell you about their home. Option D, tell the client you will take them home later.
The correct answer is option C, ask the client to tell you about their home. Validation therapy and active listening help soothe a confused resident without arguing with their reality.
Question 29. How can nurse aides best provide a client with a sense of security? Option A, by rushing through care tasks. Option B, by leaving the room without speaking. Option C, by explaining all routines and procedures. Option D, by talking to another aide while providing care.
The correct answer is option C, by explaining all routines and procedures. Clear communication and predictability help residents feel safe in their environment.
Question 30. What should the nurse aide do first when changing an ostomy bag? Option A, put on gloves. Option B, wash hands. Option C, explain the procedure to the client. Option D, wash the area around the stoma.
The correct answer is option C, explain the procedure to the client. Communication and obtaining consent are the first steps of any physical procedure.
Question 31. How should a nurse aide communicate with a client who only speaks a foreign language? Option A, use gestures. Option B, speak slower and louder. Option C, listen and say nothing. Option D, use an interpretation guide or service.
The correct answer is option D, use an interpretation guide or service. Ensuring accurate communication requires professional translation tools or services.
Question 32. Which of the following statements might strongly support that a client is considering suicide? Option A, I think I need to see a psychiatrist. Option B, I might as well be dead. Option C, I do not really care. Option D, we all have to go sometime.
The correct answer is option B, I might as well be dead. Direct verbal expressions of a desire to die must be taken seriously and reported immediately.
Question 33. A client answers every question by nodding and saying yes. How should the nurse aide respond? Option A, inform the nurse of the behavior. Option B, ask a family member to translate for the client. Option C, speak to the client with multiple medical terms. Option D, shout at the client when assisting with care.
The correct answer is option A, inform the nurse of the behavior. Abnormal communication patterns can signal a medical or cognitive change that needs nursing assessment.
Question 34. If a hearing aid is not in use, what should be done with it? Option A, placed in the client's pocket. Option B, left turned on. Option C, have the battery removed. Option D, left on the bedside table.
The correct answer is option C, have the battery removed. Removing the battery prevents it from draining and prevents the device from making high-pitched feedback noises.
Question 35. A dementia resident says she must get home for her daughter's school bus. What is the best response? Option A, let's go see if bingo has started yet. Option B, remember you are in a nursing home, your daughter is grown up. Option C, do you mean your great-granddaughter? Option D, what do you like to do with your daughter when she gets home from school?
The correct answer is option D. What do you like to do with your daughter when she gets home from school? Using validation and asking about the memory helps calm the resident without causing distress by correcting them.
Question 36. A resident with dementia tries to get out of bed without help during the night. What should you do first? Option A, orient the resident to person, place, and time. Option B, review how to use the call light with the resident. Option C, tell the resident to never get out of bed without help. Option D, try to find out if there is something the resident needs.
The correct answer is option D. Try to find out if there is something the resident needs. Behavior in dementia patients is often a form of communication. They may need to use the bathroom or be in pain.
Question 37. Normal hearing loss in aging is usually related to the ability to hear what? Option A, high-pitched sounds. Option B, loud sounds. Option C, all sounds equally. Option D, rapid speech only.
The correct answer is option A, high-pitched sounds. Presbycusis, or age-related hearing loss, typically affects the ability to hear higher frequencies first.
Question 38. When responding to a client on the intercom, you should do what? Option A, ask for the client's name. Option B, say, what do you want? Option C, give your name and position and ask how you can help. Option D, say, the nurse will answer your call.
The correct answer is option C, give your name and position and ask how you can help. Professional communication on the intercom provides reassurance and identifies the responder.
Question 39. Which of the following is considered a client's right? Option A, having curtains pulled during personal care. Option B, having personal information kept confidential. Option C, receiving and sending private mail. Option D, all of these are correct.
The correct answer is option D. All of these are correct. The Resident Bill of Rights protects privacy, confidentiality, and personal communication.
Question 40. Which type of communication can often be most powerful? Option A, written communication. Option B, verbal communication. Option C, silent or nonverbal communication. Option D, tactile or touch communication.
The correct answer is option C, silent or nonverbal communication. Body language and facial expressions often convey more meaning than spoken words.
Question 41. A confused client begins to cry and scream for their parent. What should you do next? Option A, tell them their parent is dead. Option B, give them a sedative. Option C, talk to them in a calm voice about familiar things. Option D, ignore the behavior until they stop.
The correct answer is option C, talk to them in a calm voice about familiar things. Calm, supportive communication can help redirect and soothe the distressed resident.
Question 42. To best communicate with a client who has total hearing loss, what should you do? Option A, shout as loudly as possible. Option B, write out the information. Option C, avoid talking to them at all. Option D, speak to them from another room.
The correct answer is option B, write out the information. Written communication ensures the resident receives information accurately when they cannot hear.
Question 43. Which action should you take to communicate with a client who has a hearing loss? Option A, face the client when speaking. Option B, speak into the client's ear from behind. Option C, shout at the client. Option D, walk away while you are talking.
The correct answer is option A, face the client when speaking. Facing the resident allows them to see your facial expressions and read your lips, which aids communication.
Question 44. Which of these actions best demonstrates active listening skills? Option A, looking at your watch while the resident talks. Option B, responding when appropriate. Option C, interrupting the resident to tell your own story. Option D, walking out of the room.
The correct answer is option B, responding when appropriate. Active listening involves giving the speaker your full attention and providing feedback.
Question 45. It is appropriate for a nursing assistant to share information about a client's status with whom? Option A, the resident's best friend. Option B, the local news. Option C, the staff on the next shift. Option D, the client's neighbor.
The correct answer is option C, the staff on the next shift. Handover communication ensures continuity of care for the resident.
Question 46. A nursing assistant is caring for an agitated client. What should the assistant do? Option A, shout at the client to be quiet. Option B, talk in a slow, calm, reassuring manner. Option C, restrain the client immediately. Option D, leave the client alone in the hallway.
The correct answer is option B, talk in a slow, calm, reassuring manner. Calm communication is the most effective way to de-escalate agitation in a resident.
Question 47. Making false statements orally that damage a person's reputation is called what? Option A, libel. Option B, slander. Option C, assault. Option D, neglect.
The correct answer is option B, slander. Slander is the verbal form of defamation of character.
Question 48. The CNA witnesses a resident screaming at a coworker. What should the aide do next? Option A, yell at the resident to stop. Option B, call the charge nurse. Option C, apply restraints. Option D, nothing, it is not your problem.
The correct answer is option B, call the charge nurse. Behavioral issues and verbal aggression should be reported to the charge nurse for appropriate intervention.
Question 49. A resident tells the aide they have a decision to make about a personal issue. What is the best way to respect independence? Option A, suggest legal counsel. Option B, actively listen to the resident. Option C, ask them to speak with the social worker. Option D, encourage them to listen to their family.
The correct answer is option B, actively listen to the resident. Active listening supports the resident's autonomy and allows them to process their own decisions.
Question 50. Who supervises the work of a nurse aide? Option A, a nurse. Option B, the office manager. Option C, a social worker. Option D, the resident's family.
The correct answer is option A, a nurse. A nurse. The work of a nurse aide is overseen by a RN or a LPN/LVN. The scope of practice of the RN/LPN includes having responsibility for staff who provide daily, hands-on care for clients. Open communication makes for excellent care.